Gum recession, gum pockets, and gum disease are some of the most asked about concerns that people have with their oral health. I've taught how to prevent and cure these issues for years. So today I'm sharing my very first supercut. We've put together 5 of my most empowering videos about gum health.
If you've heard some of my other videos, I talk about being on an escalator. Most mouths are on a downhill escalator. They never get better, they always get worse. It is stoppable, it is reversible. Contrary to what you will find if you go Google searching, that you have no control and the only people who can help you are your dentist. This individual, 11 years later, not only has regrown her gum tissue, but she has regrown the bone. And they can see the numbers of these periodontal pathogens, these bad bacteria that get into the pockets. They can cause a heart attack, they can cause brain damage, they can cause a risk for stroke, they can cause preterm birth and pregnancy. They are very dangerous. Would you floss a wound on your knee and expect it to like that and grow back the skin quicker? You wouldn't. You would leave it alone. You would protect it and cover it. Gum recession is not a disease. Cavities are a disease. Gum recession is damage. You will end up with no plaque very quickly. Your gums will get healthier, and then your gums will begin to regrow.
We'll start with a deep dive on gum pocketing. If you have gum pockets, your dentist has probably blamed you for not brushing or flossing enough. You may be surprised to learn the truth about what causes gum pockets and just how simple it can be to heal them.
Most people know that cavities are caused by bacteria getting inside a tooth and forming this cavity. What they don't understand is that there are other kinds of bacteria, and actually quite a conglomeration of bacteria, that can form a space or a cavity down the side of your tooth between the root and the bone, and that is called a periodontal pocket. Hi, I'm Ellie Phillips, and in this video, I'm going to explain how a periodontal pocket forms, what you can do about it, the products that I recommend you get using straight away, how they work. And if you want more information at the end of this video, I have a website, drellie.com, where you can find links to the products, more information about how to use them. And there's an oral health video boot camp that many people have found really helpful to get rid of this problem. In this video, I want to talk about pocketing, periodontal gum pocketing. And it happens to a lot of people. By the time you're 65, studies show that 97% of seniors have periodontal disease, or they have already lost their teeth, likely because of periodontal disease. So this is of importance to everybody who wants to hang on to their teeth. And it is stoppable, it is reversible. Contrary to what you will find if you go Google searching, that you have no control and the only people who can help you are your dentists. And the problem with dentistry is it is a mechanical cleaning that they're going to offer you. And I want to explain why a mechanical cleaning is not the answer. That's why they cannot stop periodontal disease or periodontal pocketing with a deep cleaning. And sometimes you can spend thousands of dollars, and I know people who are desperate because they're being told they need thousands of dollars of work done at the dental office. And I want to explain how you should help yourself and why you should use the products and the system that I recommend, which if you go to my website at drellie.com, you can download a booklet, you can see the products, how to get them. These are over-the-counter products, they are not my products. And when you put these products together, you can do so much for yourself before you go to that dental appointment. So much so that many people, when they finally went up to their dental appointment, didn't need the deep cleaning. One lady got her $5,000 handed back to her. And I'm delighted if you can save that money and do something different with it. So this is a tooth. And this would be a normal attachment of how the tooth is attached to the gum and then to the bone in which it is. And the gum line should be about the level of where your tooth meets the root of your tooth. And keeping it there, there is elastic virtually in the gum here that holds it tight against the neck of your tooth. Now, problems begin when plaque, which are floating in your saliva, in the liquids of your mouth, end up sticking to the side of your teeth. And when the plaque is here on the side of your tooth, it causes inflammation. And it causes this gum to basically be on fire. And unfortunately, this inflammation breaks down the elastic that would normally hold the tooth tight against the gum. The gum gets floppy, squishy. And unfortunately, sometimes that opens up a great big space because all this gum tissue has gone away. It's got so floppy, it's allowed a big space to occur between the root of the tooth and the gum. And the problem is that there are bacteria, not just plaque bacteria, because they like to stick on teeth, but there are bacteria that love to go into this pocket. The reason they like to go in there is they are called opportunistic bacteria. And they are all kinds. There are little squiggly ones called spirochetes. There are P. gingivalis, which is a different shape. There are all kinds of columnar ones. There are about 11 different kinds of these opportunistic bacteria that want a dark, low oxygen space in which they can multiply. They cannot multiply when they're out here in the public, in the middle of your mouth. They require this little space that opened up when you didn't brush your gums one day and your gums got infected and irritated and they began to bleed. And unless you worked really hard straight away to stop that from progressing, and you have to do it immediately, 24, 48 hours after you see your gums bleeding. You have to go back in there and keep brushing them and keep them clean and use xylitol and use my system. And then that would clear up and this would not happen. That is preventive. But let's assume you have pocketing. Well, your dentist is going to measure the depth of this pocket for you. And he or she will do that by inserting a probe, a metal stick, down where this has all disappeared and opened up, and will give you a measurement. In a healthy mouth, I would expect to have 0 or 1 as the measurement, 0 or 1 millimeters of pocketing. In other words, nothing. The minute you get 2 to 4 millimeters of pocketing, you have a space, a potential space. I'm not happy with leaving 3 or 4 millimeters of pocketing. And the problem is that these bacteria actually break down the little hairs that normally connect the gum, the bone, to the tooth. These little fibers are called periodontal ligament fibers. They're very, very tiny. They are 1/100th the width of the hair on your head. And unfortunately, the poisons made by these bacteria in the pocket dissolve those fibers, which allows more pocketing to open up deeper and deeper and deeper. That's how you get these awful measurements of 6, 7 millimeters. And once you're at 7 millimeters, 8 millimeters, your tooth probably has no support. Because along with this loss of attachment, when there is no attachment between the tooth and the bone thinks it's a waste of time, so it begins to disappear. And the bone is the thing that's holding your tooth into your jawbone. So what to do? It's pretty much a crisis, and you need to get on it. And you need to start with all the products in my Complete Mouth Care system. And the xylitol is central. You use xylitol at the end of every meal, and then you don't eat or drink. You rest your mouth for an hour afterwards so that the xylitol can feed the good bacteria, because there are lots of good bacteria that actually zap out the ones you don't want. So having a really good population of healthy bacteria in your mouth is part of the preventive process. Dentists will say xylitol doesn't help with gum disease. Well, it does, because it helps up here in the saliva of the mouth. Xylitol doesn't affect plaque bacteria in saliva, but it does get rid of some of the opportunistic bacteria that would be forming problems in the pockets. So xylitol works two ways. It feeds the good bacteria, but it also loosens up the bad guys. It loosens up the plaque bacteria. It stops them from multiplying on the sides of your teeth, and it makes this stuff looser so that if you are brushing well, it'll brush away. So xylitol is very important and foundational for feeding good bacteria, getting the plaque to get off your teeth so that you give your gums a chance to reattach and to get back tight in contact with your tooth, because that's our goal. Now, how do you get rid of these periodontal opportunistic bacteria that are in this messy old pocket? That would be the first mouth rinse that I recommend in my system. Closis is an incredible surfactant. What does that mean? It means that it goes down even little thin spaces between the tooth and the gum. I used to use it to clean the cuticles when I was gardening, and I would get dirt under the cuticles of my fingers and I couldn't get it out. I would put a little Closis and it would go under the cuticles, loosen the dirt, and then I could get a scrubbing brush and clean up my fingernails after I had been gardening. And it's kind of the same principle here. You let the Closis go down and loosen things up, basically. It reacts with saliva to form oxygen. Then you don't get a scrubbing brush, you get a really well-designed toothbrush, one of the ones that I recommend, a flossing-style toothbrush, and you would do gum massage on the outside areas of these teeth where you have pockets. Now, this gum massage is doing a variety of different things. The gum massage, when you massage your gums, is going to help extrude some of these bacteria that you don't want. It's just the way it is. You'll be on the gums. It'll get circulation there. It'll bring new blood vessels to grow into this area. And when new blood vessels grow into this area, if you're doing this gum massage in the way I recommend, it should stimulate stem cells, which are in the blood vessels in the tissue. So you have blood vessels bringing blood to your gums, and when you are doing massage, these blood vessels start to grow little capillaries into the area where you need the healing. And along these capillaries come stem cells, undifferentiated cells in your body that will be anything you need them to be. And when they reach this area and see, goodness, we've got to grow ourselves into gum tissue, that's what they do. It's a wound healing mechanism, just like the wound healing that occurs when you graze your knee. Okay, you graze your knee, you cut your knee quite badly. You don't have to do anything. Your body knows what's going on. It calls for new blood vessels to grow in. That's when it's all pink and bleedy. Then those stem cells arrive and they start turning into skin tissue and all the things you need for your wound of your knee to heal. And at the same time, there are lymphatic tissue liquids, which you may or may never have heard of. And this is a liquid in your body called lymph. And if you're massaging these gums, the lymph will take away the poisons. It will actually return it back to be eliminated from your body. So there's a lot of activity has to occur in the tissue around a pocket for it to heal up. And you can use the products that I recommend usually for 3 to 6 months. And you can actually measure, if you do my system, what does this look like? If we took a sample of your saliva, is it looking like these bad bacteria going away? Are they reducing in numbers? We can test that. You can do a salivary test and see that after 3 to 6 months, you will have lower levels of these bacteria that are problematic in the gum pockets. That's one way to test. You can also go back to your dentist and have them check with that spiky thing, have your pockets reduced. And a dentist will be shocked. They're not used to seeing pockets go away. And if you read some of these testimonials, you see that 6 and 7 millimeter pockets became 5. That's a cause for celebration. You are going in the right direction. If you've heard some of my other videos, I talk about being on an escalator. Most mouths are on a downhill escalator. They never get better, they always get worse. And the best your dentist can do is kind of hang you out there in the middle. If you get going and do this system with a really powerful, all the things I recommend, you will turn yourself around and start getting these pockets to go away. It is exciting, it is possible. The first patient who ever did this using my system was my mother. She was 45 years old and told that all her teeth needed to be extracted. These pockets were so deep, her bone was so lost, she had no support. I have another story that you can find on TikTok and on YouTube of a Down syndrome patient of mine who was 21 years old, and her front teeth had pushed out because with Downs, the syndrome of Downs, they have bigger tongues that tend to push loose teeth forward. So these teeth are always being pressured to move forward, and the bone had disappeared in the front, and the teeth were tipping, and there was no more attachment. But the mother didn't want to have the teeth taken out, and she found me. And that was 11 years ago. And I simply put them on my system of care with the gum massage, the right toothbrushes. This child is now in her mid-30s, has not had those teeth extracted. And that's an exciting, remarkable event to celebrate. When your gum pockets go away, you know how to keep gum disease away. If you start before you have gum disease, you'll never get gum disease. The sooner you start, the easier it is. If you've got 7 and 8 millimeter pockets like my mom, it's hard work. And it also depends, as you get older, on your body healing mechanism. Are you eating for your blood vessels to grow? Are you eating for your immune system to be able to cope with all this debris and take it away? Are you sleeping? Are you exercising so the circulation is working for you? It isn't just brush your teeth. It is your whole body health is coming to help you get rid of this very aggressive, very dangerous condition of gum pocketing.
Before we start the next deep dive into gum health, I want to share a powerful testimonial with you about a mother whose daughter has Down syndrome. This information is so empowering that it might seem too good to be true. But you don't have to just take my word for it. Listen to this story. Many of the things I say are different from the things you hear perhaps from your own dentist. And I know there are lots of dentists out there saying that gum recession is something that you cannot reverse. What I want to share with you now, because I can't convince you, I can suggest that you use my complete mouth care system and all the things I suggest, which are documented and explained on my website at drellie.com. But if you aren't going to try and do this between dental visits, if you need some more confidence, I can share with you today a testimonial. And I want to give you a little bit of the backstory. You see, when children have Down syndrome, one of the problems is that their tongue is often a little larger, and this tongue pushes against the lower teeth. And this creates sometimes a wider face. You'll see Down syndrome faces are sometimes a little wider than others. And the other thing that it does is it will put the bigger tongue can push against the lower teeth, and they will tip forward. This isn't so much a problem when the children are younger, but as they reach adulthood, it's easy for the difficult area to clean, which is down in the front of these lower teeth, to develop periodontal disease. And the trouble is, it's very difficult for those individuals to clean there in the way that the teeth are tipped. And if it's not, and often, I mean, most often, what happens is the teeth become so loose so quickly, they lose bone, and then they have to be extracted. And this lady that you're going to hear in a few minutes, exactly that was the story for her child. She came to me because she had been told by 2 other dentists there was nothing she could do but have these lower teeth of her daughters extracted. And she was aware that if you extract those lower front teeth, the trouble is that this larger tongue will push, and it's almost a domino effect. The back teeth also get lost until quite frequently, by the time a Down syndrome individual is in their 30s, they have no teeth. And it's very difficult for them to wear dentures for the same reason. The tongue, very active tongue that pushes the denture out. So most often, these individuals are rendered indentureless. They have no teeth, which is a big, big problem unto itself, especially for a young person. So this mother was very keen to know what I had to say about the situation. And I encouraged her to help her daughter learn to use the complete mouth care system with regular xylitol at the end of meals. This is what they did. They did the gum massage, they used the 2 toothbrushes, they used everything that I recommended. That was it. 11 years later, this is the testimonial story that I am going to let you listen to from this mother who spoke with me over the phone. She wasn't aware there was going to be an improvement. And what you will hear on this testimonial is the story of the improvement to the point where now, today, in 2023, this individual, 11 years later, not only has regrown her gum tissue, but she has regrown the bone, even though there was a 50% bone loss. And this is what I'm telling everybody. You have hope. It doesn't matter if you've lost bone. It can regrow. It will only regrow when you regrow the gum tissue. You can't regrow the bone without the gum tissue. But if you start using the products in the way that I recommend, it is very specific. Go to the source. Don't listen to other people and hearsay, because it is so easy to get the wrong products and do this the wrong way around. Make sure you're doing the complete mouth care system in the exact way that I recommend, and the gum massage around the gums, and then see for yourself what you can do. These guys worked really hard, but you will hear the joy, you will hear the difference, and I want you to enjoy this testimonial.
Hi, everyone. My name is Beverly, and I am from New York. I have a personal testimony I wish to share. I have a Down syndrome daughter who at age 27 discovered her 2 front bottom teeth were loose. I took her to our dentist. They took an x-ray and told me there was 50% bone loss in her lower bottom teeth and gum recession. Her dentist made the suggestion I see another dentist, and he would probably recommend pulling both teeth and putting in a bridge of some sort. I did not like that idea of putting her under anesthesia and pulling the 2 teeth out and having who knows how many follow-up appointments, lots of expense, and putting her through anxiety and stress. I wanted to find a good home care system to save her teeth. I was in Barnes & Noble's bookstore, and I found a book called Kiss Your Dentist Goodbye by Dr. Ellie Phillips, DDS, an amazing dentist who has studied dental problems in special needs children and in the geriatric population and for adults in general. I bought her book and was blown away with all the information on dental health. Dr. Ellie is one-of-a-kind dentist, honest and truly out to help everyone. And her advice was the miracle I needed. Dr. Ellie offers affordable coaching services, so I booked a 30-minute session with her. She she recommended a complete mouth care system that was easy and very doable. My daughter is now 38 years old. It's been 11 years since we had this problem with her mouth. Her bottom two teeth are rock solid, and she has no bone loss and has a very healthy mouth. I urge every mom out there to purchase Dr. Ellie's book and do a 30-minute consultation. Our dentist offered us no hope but to extract her teeth. Dr. Ellie gave us hope and a cure. I will always be forever grateful to this dentist, for she is so different than our average dentist we meet every day, who only think of surgery and offer us no cure beyond what they've learned in school. Please, I beg every mother out there with a Down syndrome child to contact her and change your daughter or son's future for the best. Thank you, Dr. Ellie. We love you.
What an incredible story. I'm so thankful for her courage and willingness to share and encourage others to follow her path of using these simple techniques. In this next video, you're going to learn what truly causes gum disease and recession so that you can prevent it and heal it. This video is about receding gums and what you can do to fix them. Most people end up with recession problems somewhere in their mid to late 40s, and as they get older, they usually get worse. Gum recession is damage. It is a physical damage of some kind. Usually, if you can take away the offending problem, recession then can heal very quickly. Your gums will get healthier, and then your gums will begin to regrow. If you keep doing the wrong things, it will simply get worse or it won't get better. So this video is about receding gums and what you can do to fix them. Now, you may be thinking that you don't have receding gums. Maybe you've never been told about your gum health. If you are 30 years old, be aware you may already have problems starting, particularly if you've done anything like whitening your teeth using baking soda or peroxide, or if at some point your gums were bleeding. So hang with me here and let me explain how receding gums occur and how you can prevent that from happening to you and becoming a real problem. And also, if you have receding gums, what are your options? What can you do? Well, you can ignore it. Again, if you don't know you have gum recession, you can just turn off this video or listen and realize that prevention is adopting the plan for reversing the problem before it starts. That's basically what prevention is. Taking the steps that keep your gums healthy. And if you already have recession, then using these steps that I'm going to give you to try to reverse the problems. If you do nothing, most people end up with recession problems somewhere in their mid to late 40s. And as they get older, they usually get worse. And the result of leaving it is that your teeth will feel sensitive. They'll be more prone to decay around the edges of them. And this is where you end up needing either a crown or something that's bigger than a filling, or a very difficult filling, or worse yet, that you need to have a root canal or have the tooth extracted. So recession isn't something you can really just ignore. The treatment offered today for recession is sort of a kind of Botox, which puffs up your gums and makes it look better, but it really doesn't deal with the underlying causes. You can have grafting, which is kind of like plastic surgery. Again, if you still got the problem in your mouth, why would you do this? You go through all the pain and suffering of grafting maybe skin from the roof of your mouth to go over the sides of your front teeth. But the problem is, if you don't figure out why you have recession, which is what I'm going to talk about, it's simply going to come back. You'll pay your money. It's usually quite expensive. You'll go through the pain and suffering. can be quite nasty too. And then 5, 10, 15 years later, you will definitely be readdressing the same problem. And after you've done grafting or this kind of pinhole, as they call it, or puffing up the gums surgery, usually you'll be in a worse state 15 years from now. So I recommend that everybody considers how you can work to reverse recession, whether or not you've even been told you have recession. So were you told you couldn't reverse your gum recession? Many people are told this, and I'm going to try and explain to you why you can reverse gum recession with the right strategies. I suggest, like I always suggest with everything, why don't you use the interval between this moment and your next dental appointment to see what you can do? Just give this a try. Maybe it's only a month or 2 months or 3 months. But I want to tell you one thing. If you find your mouth health is going in a new direction, that your teeth feel smoother, your gums feel better, just keep going and you will see improvements. Many people have been told they caused the gum recession with poor toothbrushing, or they brushed the enamel of their teeth too hard. First of all, healthy tooth enamel doesn't wear away. Healthy tooth enamel is harder than steel. It has a Mohs pH hardness of 5. You can look that up. You can Google search. And steel, you will find, metal, has a Mohs hardness number of 4.5. If you have a toothbrush, it's not going to wear your teeth away if your enamel is hard, is healthy, is how it's supposed to be. I'm not calling your dentist a liar. I'm just saying that most dentists see patients whose enamel is not healthy. And that is because most patients do not know they need to mouth rest after eating. They don't use xylitol, and they don't use my complete mouth care system or the products that I recommend that bring your enamel into its peak hardness. When your enamel is hard, you will be able to brush your teeth and your gums, which we're going to talk about in a minute, with enthusiasm, with vigor, and effectively, and do gum massage and everything in your mouth that will help your gums to recover and regrow. But you have to get your enamel healthy first. And in order to do that, you have to understand that acidity always softens your teeth. So if you're sipping and snacking all day, whether it's on sparkling water, soda, coffee, tea, particularly anything that has a citrus factor, if it's got a little bit of lemon, you're going to soften your teeth. You're literally pulling the minerals out of your teeth and leaving them vulnerable to being worn away. So yes, your dentist is right in one respect. If you have unhealthy enamel, you have the potential to wear it away by brushing. He will then recommend to you, or she will recommend to you, a soft toothbrush. When you have a soft toothbrush, you're not going to be able to do gum massage. And if you can't do gum massage and massage your gums, get the circulation, the lymphatic drainage, the movement we need in your gums, you're going to get gum recession that isn't going to be reversible. You must get your enamel healthy by mouth resting and by using good products. And the products I recommend in my complete mouth care system would be my recommendation. Once you have looked after your tooth enamel, you are going to be able to use a better toothbrush. And I recommend a flossing toothbrush that is quite resilient. And I do this because you're going to need to massage your gums with it. So taking that aside, we have now opened the door to the possibility of you being able to do gum massage, correct mouth care, mouth resting, which is when you eat and drink and then have a period of time after your meal where you do not eat or drink, and you're using xylitol, especially after meals, before this mouth resting period, so that your saliva is full of minerals and immune cells, and xylitol feeds the good bacteria in your mouth so that it helps your gums to regrow. All right, so that is one strategy that you have to get your head around that is different from what you've been told. The second part of this, if you're trying to reverse gum recession, is that it all depends on the health of the gums between your teeth. And for this, I'm going to show you a little analogy. If you have a necklace and you want to raise it up at its lowest level, you can't push it up. And your gums are the same. I have people trying to massage their gums up. It's not going to work. You get your bottom curvature of your gums, the part that's receded too low, to come up by actually pulling on the sides. Raising the side up will bring your gum level up. So I hope that helps you understand that it is the gum tissue between the teeth that is so important and so vulnerable and so vulnerable and valuable for regrowth of the receded part that's at the bottom of the curve. So we're looking at massaging the gums between the teeth and all around. And that does go actually below the curvature part and on it everywhere. I want you to be able to brush everywhere. One of the reasons I tell you this is that if you are an avid flosser and you're jamming the floss in and out between your teeth, you will be beating down this tissue between your teeth. And a lot of women end up with gum recession. They don't understand it. They do more flossing, and the gum recession will simply keep getting worse. I tell those women, men too, if they're doing it, but it's usually the women who are so compliant, stop flossing. Let's use liquids. If you're using my complete mouth care system, the liquids are going to be swished in and out between your teeth, and that will do the flossing without any risk of causing these high points between your teeth to get beaten down. So if your gums bleed, if you're worried and you're flossing because you've been told that your gums bleed and you need to floss more, I am still going to tell you, in my opinion, you will have more success by retiring the floss. And I'll tell you here, I haven't flossed a day in my life. I use flossing toothbrush bristles to remove food, to clean around, and mostly to do this gum massage that is so important for the health of your gums. If your gums are bleeding, you need to stimulate a healing response inside the gum tissue. Imagine you grazed your knee. You don't run for a length of string to rub over your knee. Your body actually calls for stem cells and blood vessels to grow and heal the wound and regrow the skin. And that's what the gum massage does. It stimulates a healing response in the gum tissues. It actually calls for new blood vessels to grow to that area that you're vibrating with the toothbrush, and new blood vessels and new cells will come there. Now, some people are scared to brush because they've been told they wore their gums away. I would say to those people, give me one other place on your body where you brush it or rub it a little more and it becomes thinner. As far as I know, when I do gardening things and I rub my hands more, it develops calluses. When I write and my pen rubs against my finger, I don't see the bones through my finger. I see a fatter piece of skin. The bottom of your feet, we rub on them all day long. What do? They get thicker. So this idea that because you brush, your gums get thinner, in my opinion, is completely flawed. And I pay no attention to it. I teach gum massage, and people have seen spectacular results.
I know you've been told to floss because if your gums bleed, you need to toughen them up. I would suggest that the PFAS chemicals in floss, the trauma simply by beating your gums with it, does not help. Water flossing, I prefer to use rinses because you have so much more control and it's going to go everywhere in your mouth in a better way without the pressures and the pressure points that sometimes water flossers put in the wrong place. Our goal is to grow this tissue back up between the teeth. And one of the ways that helps is, again, I'm going to go back to the idea of xylitol, because xylitol, in addition to all the other great things it does, like stimulating a flow of saliva and feeding good bacteria, it actually also makes plaque less adhesive. So you don't get it stuck by your gums. And the other reason gums bleed, usually, if it's not because they're not healing well enough, it's because they got plaque stuck on them. And if you're using the adequate amount of xylitol, that plaque will go away. You don't need floss to make it go away. It will be eliminated. I have 0 plaque-forming bacteria in my mouth. So you can get there too. It requires a little bit of xylitol at the end of every eating and drinking period, followed by mouth resting. And if you can do that 4 or 5 times a day, you will end up with no plaque very quickly. Your gums will get healthier, and then your gums will begin to regrow. Now, that said, I also have to warn you that you need to find out, like any forensic investigation, why do you have gum recession? So possibly the most important thing for anyone with gum recession who's been told they've got gum recession or thinks they've got gum recession is to figure out why. You have to do a forensic look at why this has occurred. You either had a very acidic mouth, or you overflossed and beat the caul, the tissue between your teeth, down, and that caused your gums to go down. It can be chemical. Maybe you're whitening your teeth with peroxide, or baking soda is another thing that strips your teeth of its protection and can leave your gums in danger. So if you have been using a baking soda toothpaste, peroxide, whitening, if you've been using a lot of acidity in your mouth for some reason, some people rinse with cider vinegar. They're told that's healthy. It can cause dreadful gum recession. I mean, really bad, aggressive gum recession. Heavy deposits of plaque because you were a snacker, a sipper, you never rested your mouth all day long. These are all reasons for gum recession. And they're easy because all of those things can be changed. You can stop doing them right now. If you've been going for dental cleanings every 2 or 3 months, thinking it was a healthy thing to do, too many cleanings, good for the dentist's pocketbook, but I believe it strips away the healthy biofilm, and there are much gentler, safer ways to keep your teeth clean and healthy with the right kind of mouth care routines. I would suggest you look into my complete mouth care system. So now this brings us to the really tricky place. What if none of those things ring a bell? Maybe you're using my complete mouth care system. Maybe you mouth rest very well every day. Your nutrition is good. Your health is good. But you have this recession. And maybe you're young. Maybe you're old. It doesn't matter. Why is it happening? The next place I look is your nasal health. Do you have sinus problems? Do you have allergies? Are you taking medications? Medications for the allergies or the sinus? Because if it's drying up your mouth, if it's drying up your saliva, you're not getting those salivary benefits. So look into that. Saliva also dries up if you've been started to take blood pressure pills. Sometimes it's something like that, or antidepressants. So try and see when this started. Try and see if you could identify a medication you began at that time, or
as I say, a sinus issue or an accident where your nose was broken, or there are usually some indications of why. You can correct that in any way. Talk to your doctor about the medications that are drying your mouth. See what else you can do. Use more xylitol. Those would be ways around it. Now, dry mouth can occur, you may not even be aware, if you move to an arid, dry climate. Maybe you're living in the desert now and you used to live in Seattle, Washington. That can cause a change in your mouth health. You may need to have some sort of humidifier in your room at night, especially if you breathe through your mouth, if you sleep with your mouth open, or at that time of night where your saliva is at its worst. So those are things to think about straight away. Breathing through your mouth doesn't necessarily create a problem. If you're using my complete mouth care system, it's usually adequate to give your mouth enough protection. If you're not, if you're using some fancy $25 toothpaste that's good for teeth and not for gums, be careful, because there are ingredients in some of these toothpastes that are good for teeth and bad for your gums. Arginine is one in particular that I think you should be very careful of, along with baking soda and anything with peroxide. So that said, I recommend a complete mouth care system that I'm comfortable with. If you live in a country without the complete mouth care system, my next best choice would be a Miss Wax stick. I love them. I think they're great. We're at a point now where we've gone through a lot of things and it still doesn't ring a bell with you. My next question to you would be, did you have orthodontics done in the past? Do you wear a retainer? Are you using a night guard? Did you start Invisalign? In other words, did you recently mess with your occlusion? And I think we can add into that now, because the materials that people are using for implants and crowns are so hard today. They are rock hard. And if you have a new implant, it could have affected your bite. And if you've had orthodontic work done, it may have affected the way your teeth bite together. And it is that crunching on a tooth that can cause the damage. You see, a really important thing to remember, if you remember nothing else, remember this. Gum recession is not a disease. Cavities are a disease. Periodontal disease, gingivitis, they are diseases. Bacteria, they can be cured by getting rid of the disease. Gum recession is damage. It is a physical damage of some kind. And this damage has been done by chemicals. It can be damage from chemicals produced by bacteria, but it is damage. And this damage can be caused by a bad bite. And I would encourage you, if you've explored all these other options that we've looked at today, to go and try and find a dentist who knows something about biting. It's called occlusion. And one of the most respected dentists in dentistry did a podcast this week lamenting the fact that today dentists don't understand occlusion and the vital importance of how your teeth bite together. So try and find a dentist who's experienced. Try and find an orthodontist who has years of experience. Ask them. Prosthodontists are dentists who have particular expertise in occlusion. Usually they know about this. So if you are able to get to a hospital, a teaching hospital, a dental hospital that has a prosthodontic department, that might be a way to go there and ask them if they see anything about your occlusion that could be causing the recession. Of course, you would expect that your gum specialists, your periodontists, would be the people to go to, but I'm not sure how much occlusal knowledge is being taught to periodontists. I hope it is. But I want you at least to know that there are these different specialties in dentistry, and learn the difference. And if you're getting gum recession that's not getting cured, not reversing, before you have surgeries or lose teeth or just give up, see somebody who knows about how your teeth bite together. And I'm hoping that in the future, this will be perhaps a specialty of its own. And finally, if you find you grind your teeth or you find yourself biting on a particular tooth at night, it could be something to do with your airway. So see a sleep specialist or an airway specialist and just make sure that you don't have a restricted airway, because sometimes grinding your teeth is a signal that you actually have airway obstruction and your body is basically trying to wake you up to do something about it. So that's another avenue to explore along with all these others. But usually, if you can take away the offending problem, whether it's flossing, bleaching, snacking and sipping, bad mouth care products, or something wrong with your occlusion, and by taking it away, I don't mean get a night guard. I mean figure out what is the problem. Maybe it's taking out the night guard and letting your teeth just find their way back to where they want to bite. But recession then can heal. So I'm sure there are some of you out there with questions. It's a very worrisome topic, especially if you're in the middle of it and you're fighting with it, and if you're young. I had a gentleman the other day, 39 years old, and his back teeth don't bite together. And he's been working to try and get his gums to regrow, but they won't regrow if his teeth don't bite properly. So if you have questions, please leave them below. Ask for help. So I will do whatever I can to try in video form or answering your questions below to help you figure this out and figure out for yourself how you can reverse the problems. But don't forget, it may be quicker and easier for you to go and have somebody look at the way your teeth bite together. If you suspect that you had a tooth taken out or you had things done when you were younger, that this is the reason, go see an orthodontist. Go and get an evaluation. There's an academy called the Dawson Academy, and they specialize in occlusion. You may want to try and find a Dawson Academy graduate as a dentist who has studied occlusion to look at your mouth. These are some of the best suggestions I have right now, beyond maybe finding an airway specialist, a dentist who is an airway specialist. That would be another way to go, because they could also look at your occlusion. So if you're ready to start to get rid of these problems and change your mouth health, get started today. They're very simple. 3 very simple things will help you a lot, and you'll find them all in the next video on biohacking dental problems. If you have gum pockets, your dentist has probably told you you need a deep cleaning. What if I told you that was backwards? I've mentioned deep cleanings already in this supercut, but it's time to fully investigate what you need to know and maybe flip what you thought you knew on its head. You may have just come back from the dentist and been told that you need a deep cleaning. What they are telling you is that you have a periodontal problem. You have a disease in your mouth, and it is a disease caused by bacteria that are in our saliva. They're always there. I mean, we can't stop them being there. But what has occurred is they have found a place, a habitat in your mouth where they have found the ideal conditions to multiply. And when these, what they call opportunistic bacteria, these are these little bacteria that wait for the opportunity, find this little pocket space between your tooth and your gum, then in that space, they create poisons that basically disable the mechanism that holds your gum tightly to your tooth. And this opens up something called a pocket. And into that pocket, these opportunistic periodontal pathogens, that's a mouthful, basically bad guys, bad bacteria, get in there and they create inflammation, they create poisons that gradually break the connection between your gum and your tooth. Sometimes in certain mouths,
the bacteria of plaque also get in that pocket, and they harden up, so you will have what's called subgingival calculus. This is crusty plaque down under the gum line. It can also be on top of the gum line if you're a plaque former, but it can be everywhere around your teeth as well. But it is the pockets that are the real danger. What your dentist is believing is that by scraping and cleaning this gap space between the gum and the tooth, that you will be released of some of the burden on your body that you are going to experience from these opportunistic bacteria. Unfortunately, dentists do not believe that this disease can be cured. And the reason that they have this philosophy is that they have been unsuccessful. You see, you can take a test. If you want to take a test, there is something called an oral DNA test. And you spit into a test tube, send it to the lab, and they can see the numbers of these periodontal pathogens, these bad bacteria that get into the pockets. And we know that when they reach a certain level in your liquids of the mouth, in your saliva, that they are multiplying rapidly. And that is when they can cause damage to your body. They can cause a heart attack, they can cause brain damage, they can cause a risk for stroke, they can cause preterm birth and pregnancy. They are very dangerous, and they are connected with a lot of chronic inflammatory diseases. So you cannot ignore these bacteria. And if you have a test of your saliva and that's what it shows, your dentist is going to recommend this deep cleaning to try to clean out those pockets. Your hygienist may recommend some sort of squirty water pick to try to wash out the pockets. They're going to try and do everything mechanical that they can to clean. Now, the problem is, if you don't clean your saliva, chances are that your saliva is going to go back down in that pocket, and it's just going to keep reoccurring. And the real sad part of this is that many dentists prescribe antibiotics, which will work for 6 months to a year, and they will retake your test and you will see all the bad guys have gone away. But the trouble is they call it a refractive problem. In other words, it comes back again. And the only reason it comes back again is it was never cured in the first place. But if you can get your periodontal pockets to seal themselves up, if those pockets can be reattached, which I believe they can, and you have no more of that gap, that pocket, not only will we see a reduction in the number of these bacteria in your saliva, but they won't reoccur. And this is so important because this is a transferable disease. Once you have those pockets sealed, once you have reestablished the connection, when you no longer have periodontal pockets, you cannot then be at risk. So if your dentist wants to do this deep cleaning for you, it sounds like a great idea, right? A good way to start, perhaps. Not so fast. It was shown that if you had a deep cleaning, immediately after that, you would have more pathogens in your mouth. And that might be a weird thing to get your head around unless you have a garden and you rototill weeds. Because if you chop up weeds in your garden and don't pull them out or kill them in some other way, the chances are you will have more weeds after you have rototilled the ground. You chop them up and you leave the seeds lying around, you'll just have more of them. Don't be at all surprised if the following year everything is back to where it was before. So my suggestion would be use my Complete Mouth Care System and xylitol for ideally 6 months, but if you're scared, 3 months, and then go back and have the deep cleaning. You could either have a periodontal pathogen test done before you start. It's good to have a picture of your problem, and then, of course, you can see your progress. It's about $200 per test, so you may decide, well, why test now? I know I have a problem. Let me just work on it for 6 months and then test, see how I'm doing. You won't have quite the same satisfaction, but you will at least have a benchmark of where you are. And I'm not telling you that your use of my strategies is going to make your gums completely heal straight away. I call them the 4 keys. One is your oral care routines, which is how you brush, what kind of brushes, what you use, all the things that I teach my clients. Second thing, how much time you give your mouth to heal itself. You see, we have this incredible liquid, our saliva in our mouth, and it is full of immune cells that can help heal your gums. So we have to give it time. And I teach people the afternoon hours are ideal for this healing. So have your meals, have some xylitol, and then really try to give your mouth time, an hour at least, when you are not eating or drinking anything, not even sips of water. And that beautiful undiluted saliva will help to heal your gums. So that's the second thing, what I call mouth resting time. The third thing would be your diet, your meals. What do they look like? What are you eating? Not only nutritionally, but also the patterning of eating for your health. And then the final thing would be, how is your digestion? How is the health of your digestive bacteria? Usually, in periodontal disease, there is a digestive imbalance component. This is important to realize because if you work at your mouth health with poor digestion and poor immune health, you're not going to have this natural healing that is necessary to help you. So as you work on your mouth health, realize also you need to work on your digestive health. I recommend you work from the far ends of the spectrum. I would always give somebody a colon health probiotic. I happen to like Garden of Life. I think they do a great job with their probiotics. Very simple. You can buy it in grocery stores quite easily in America. But a probiotic that helps you with your digestive health at the same time you're working on your oral health. Please note, I did not say an oral probiotic. We can't improve our mouth the same way that we improve the bacterial diversity of our gut. Our bacteria in our gut, they float around, they're independent, they can be nurtured by probiotics. Our mouth bacteria that we're dealing with are very static. They aren't easily changed. And I have other videos about this, but just take it from me. Using an oral probiotic may be a complete waste of your money. Most of them contain some xylitol, which is good. That will make them work a little bit. But better to use just xylitol for now, certainly in the first 6 months. It's also important to consider your nasal health. Many people forget this. It is a crucial component of gum disease. Chronic sinus infections are often the same kind of bacteria that we find in periodontal disease pockets. That is the time, after you've done what you can for 6 months, and your dentist then says you still have a problem, maybe taking an antibiotic will help you get rid of sinus problems, get rid of your mouth bacteria, all of them, because that's what an antibiotic is going to do. It's going to wipe out good and bad, all of them. Reestablish the good ones immediately by using xylitol and my complete mouth care system. By doing that, along with taking care of your colon health and your diet and nutrition, you should be able to not only cure your periodontal pockets and stop the need for these ongoing treatments, but you might find a substantial change in your overall body health. Many, many people report to me once they have their nose, their mouth, and their digestive health in balance, they had so much more energy, so much more health benefit as an overall. So do what you can for the first 3 to 6 months using the strategies I recommend. Then go back for an evaluation, potentially have a deep cleaning if they still recommend it. If, however, like many, many people, the exciting moment comes, you go back and they say, you don't need anything, that is a great moment for you. You may be skeptical and say, well, no dentist is going to tell you you don't. There are dentists who are totally honest. I have been to them and they have told me I don't need a cleaning. And eventually, I hope you get to that place where you are told, congratulations, you no longer need a cleaning. Because that means your mouth is in balance, you don't have periodontal disease, you will be protected from infection, which is a huge and very important thing, particularly as we age.
We're going to wrap up this supercut with my second most watched video of all time, with over 4 million views. This is from early in my journey on YouTube. No studio, just me with some paper and markers. This covers some new ground, but will also leave you with an overview of all the things I've been sharing with you in the supercut so far.
A lot going on here, I realize that, and I'm going to try and simplify this. But it is a complicated topic because it occurs a lot, and there's a great deal of misunderstanding about the reasons or the causes for gum recession. So first of all, let's look at the tooth. Try not to look at all the words on the side. Just let's look at this tooth. This is a section through the tooth with the enamel on the outside, and then the red part, which I took some time to color in so that you can see the problem. See, the problem if you have gum recession is that you expose the part of the tooth between the part that's covered by enamel, which is the enamel covering kind of ends here at the gum line, right here. And when your gum recedes, as you see, the gum on this side is higher. When it recedes down, and we'll talk about why that happens in a minute, it leaves the root of the tooth, the part that's not covered in enamel, exposed. Now, this may just be a millimeter or two, but sometimes it can be quite a substantial area. And the trouble is that the cement, which is on the outside of the root of a tooth, is just not equipped to deal with all the things we eat and drink, the acid attacks, the sugary attacks. It has no covering like enamel. Enamel, as you will learn if you follow me, has the ability to repair and regenerate itself every day so that it stays strong, it stays protective. Unfortunately, the cement in the root of your tooth is not designed to withstand those same challenges. And the problem then occurs, not only could that be sensitive for you, and we're going to talk about this here in a minute, the symptoms, but you can get this part of the tooth to gradually wear away. And what happens then is you get this dip, you get this missing part of the tooth here on this exposed area where there is no protection. So the tooth begins to literally wear away. And the reason that I did all this red coloring is to show you when that occurs, how close you are to the nerve in the center of the tooth. And you have no protective covering. So no wonder this is excruciatingly painful. No wonder your tooth is telling you there's a problem. And this is why I don't really personally believe the best treatment is to put a filling there. I have gum recession that occurred when I was a dental student, and I have never had it fixed. Never had those side little dents in my teeth covered over. They are fine now. They have been there for 50 plus years. And they're no longer sensitive because I've allowed the inside of the tooth to do its healing, which it does. If you take care of it, it will do its healing. And the gum has grown up substantially. It hasn't completely because I lost some tooth area, and you can't get the gum to grow back up when you have lost, you've got this big indent into your tooth. So let's talk about why. You go to the dentist and you have this sensitivity. You probably have pain when you eat something hot or cold. very acute. I mean, I've had people who've got, they just can't drink hot coffee or anything iced anymore. That margarita is impossible. And the other real issue, if you are in a mouth that was a lot of sugary or carbohydrates being eaten or sipped drinks with sugary drinks, that you can get tooth decay here. And as we've said, there's no protection. You're incredibly close to the nerve inside the tooth, the vital part of the tooth. And it is extremely easy for these side lesions, this erosion, or if it's a cavity that then starts to form, that you can kill the tooth. And if you kill the tooth, I have nothing in my toolbox to bring a dead tooth back to life. So if a tooth is dead, you need to either have a root canal done or you will need to have the tooth extracted, and then maybe you have an implant. There is no miracle cure right now for bringing a tooth back to life when you have killed the nerve. I think that maybe in the future, when stem cells get really used well, I think there's a possibility. But at this moment, if you allow the decay or the damage to occur into the nerve in the center, your tooth will probably die and need a root canal. And that is the reason, again, that I believe it's almost better not to have a filling, because in order to make a filling work, your dentist has to put quite toxic, quite acidic things right at the base of this filling in order to get it to stick. And just putting something really acidic that close to the nerve can be a reason that the nerve dies. So I would advise you to take your time, to rush into having a filling, consider the options. And one of the options is not to do anything, but do preventive work to strengthen your teeth, to grow back the gum as much as possible, get your mouth truly healthy, reform the layer that you may have lost, which is your protective biofilm. This is a covering that is supposed to be over your teeth. And we're going to talk about that more in a minute. That gets melted away by using wrong oral care products or artificially whitening your teeth. You will melt away the protective layer that stops your gums receding in the first place. So let's start here and tell you what this is not about. If you came to me and you had a groove along the upper teeth and down maybe along the lower teeth, this erosion like this, I would not tell you. I would not tell you. As a dentist, I would not tell you that it was your fault for brushing the wrong way. Unfortunately, lots of people get told that. And it's not the fault of your brushing. If you had been brushing enamel, enamel is extremely hard. It's not going to be damaged by your toothbrushing. And you didn't cause, you weren't the reason why your gums receded. Something else occurred to make your gums recede. And once they have receded, then you have to be careful what you do, because yes, then perhaps you could wear away the cement on this soft part of the tooth. But the reason that I don't want you to be scared of brushing is that it requires brushing to regenerate the gums back up the tooth. So I do not believe it's about brushing. I believe the reason that you lose your gums and they shrink down your teeth, the first thing to think about is how acidic is your mouth and for how long every day. Are you sipping soda? Are you sipping sparkling waters? Are you sipping white wine before you go to bed at night and not changing the pH in your mouth before you go to bed, to go to sleep? Maybe you have a dry mouth. There are these reasons, and that around the topic of acidity, which I talk about a lot, because the more acidic your mouth, the more chance you have for erosion, for enamel crystals breaking off your enamel, which can happen at the end here, right above the junction where your enamel and your root of your teeth meet together. Little enamel crystals can break off and make this area of erosion actually worse, higher and worse. And you can literally have lost some enamel. So look for acidity as one of the main reasons for your gums receding, and also for loss of enamel that leaves you with this groove up at the gum line. Some people believe that it's to do with grinding your teeth and the bending and flexing of your teeth that creates this erosion, this wearing away. And that's partly true. Again, these little crystals can break off as your teeth are moving, but they won't break off if you have prepared your mouth adequately, if you have this protective covering over your teeth, if your teeth are properly cared for every day. The reason that you might get that to happen is if you have acid reflux, if you're going to bed with something acidic on your teeth. And let me warn you now that a lot of mouth rinses are acidic. And you don't want an acidic mouth rinse except in very unique circumstances. So let's not go into that now, but there are lots of things that you may be doing if you're sucking citrus fruits a lot, if you're again, whitening your teeth. There's a lot of acidity, and the Crest White Strip, it has a pH of literally battery acid. And these are things people don't realize. And then if you grind your teeth, if you have acid softened teeth, if the crystals have been eroded and basically dissolved away, and these little crystals here easily fracture off your teeth, your dentist may want to give you a night guard because you grind your teeth. If you're not going to change your habits, that might be the best thing to do. If you're prepared to change your habits and deal with the underlying problem, you can stop this from occurring and avoid having a piece of plastic in your mouth 24/7 for the rest of your life. I know I wouldn't want a night guard. So it's up to you. If you were not going to change your habits, if you're not going to do a better job with using products that help and support your enamel, then maybe you need a night guard. But that's not the therapy that I would recommend. So you have this sensitivity, you have this pain, you have the potential for decay, you have this groove, and you have your gums that have receded. So how do you get it to grow back? Let's talk about that first. Well, I would begin by looking at the kind of toothbrush that you have. Try to make sure your toothbrush isn't too soft. You need a brush that will be able to stimulate and massage your gums, because that is how you get new blood vessels through a process called angiogenesis to regrow. And as they regrow, they can support the new growth of this gum tissue. Even if you've been told gum tissue doesn't regrow, if you support it, if you massage the gums with an adequately resilient toothbrush, you will stimulate new blood vessels, and new blood vessels can bring the necessary equipment that your gums need to regrow. And even if you've lost bone, if you can regrow the gums, you can regrow the bone. Can't regrow the bone until you regrow the gum tissue, but both can regenerate. It isn't out of the question. So don't give up until you looked at my videos on my website on the boot camp. Videos 1 and 2 are actually, you can access those very easily and learn how to massage your gums with a toothbrush. There are also YouTube videos. I have talked about this a lot, but if you go to drellie.com, you can learn how to massage your gums and what kind of toothbrush to use. Not a soft, squudgy, feather soft toothbrush. Just because you have gum recession, the last thing you want to do is use a soft toothbrush. You need a toothbrush that can support the regrowth of your gum tissue. And I would recommend that along with those things, you use my complete mouth care system. And I won't go through that now because we have videos of that, but it is a sequence of mouth rinsing that goes together with certain kind of toothpaste and the use of xylitol. And what that complete mouth care system can do is get rid of any potential infections, stop any decay that might be happening, help to regrow the protective biofilm over your teeth, and help your gums to regrow healthily back. And the sooner you do this, if you've just started to see some gum recession, the sooner you use these techniques and stop damaging your gums, which is the last thing we're going to talk about here. What damages your gums? Really, the secret for why you have gum recession, which is not what you're usually told. In my opinion, you want to look here for your problems. And when you do these things, the gum massage, the great brush, the complete mouth care system, and xylitol all together as a new strategy for looking after your teeth, usually within 6 months, you will see those gums regrow. But you have to stop damaging them. And you stop damaging them by stop flossing. Stop it. Do not floss. Every time you floss, you are beating on these gums. It is not because you have an infection that you have gum recession. It's unlikely. And even if you do have a gum infection, I do not recommend floss as the number one thing you should be doing because you could push the bacteria into your bloodstream. Your best bet is to use these complete mouth care system, the sequence of rinses, the xylitol, and the brushing. Avoid flossing. If you have something stuck, a little bit of food stuck, then do it very, very gently. Treat this like a wound. Treat your gums that have receded like a wound. Would you floss a wound on your knee and expect it to like that and grow back the skin quicker? You wouldn't. You would leave it alone. You would protect it and cover it and try and encourage it with good food, good nutrition, boost your immune system. All those things are important. Sleep, exercise, circulation, joy, all those things are part of healing. And this is all part of healing. But on a more practical level, for what else you should stop doing, you absolutely have to stop whitening your teeth with artificial whitening products that contain strong acids and peroxide. No wonder your gums don't like it. It is a crazy thing to do to your gums. And a crazy thing to do to your teeth, too. But also, the use of baking soda. Lots of people think they want to make their own homemade toothpaste with baking soda and sometimes peroxide mixed in it, and sometimes some clove or neem or some other lavender essential oil of some kind. They've heard eucalyptus is good for regrowing gums. Don't make your own products because they are too strong. You need such a tiny amount of something that works. Neem does not work for making your gums regrow. Neither does clove oil. And if you use clove oil where it's painful over here, I will guarantee that you will kill the nerve inside this tooth. Because it will diffuse. These essential oils travel. That's what they're good at. They're good at diffusing through. So if you were to put clove oil on this painful side of your tooth, you have just killed your tooth. So don't use these so-called natural therapies without knowing what you're doing. And so no whitening, no baking soda, none of the clove oil or neem. Don't, whatever you do, go and have a dental cleaning at this moment, because that will strip again the healthy biofilm that we need to protect the outside of your teeth and to protect the outside of the cementum. That your biofilm, when it's healthy, this protein layer forms all over your mouth. And during a dental cleaning, it will be cleaned off your teeth almost completely, mechanically cleaned away. And I am saying you need every single millimeter of that protective covering until you get your gums to regrow. So continuous cleanings are going to be working against you. And the only reason to go for continuous cleaning is if you really have horrible oral health. And if you have horrible oral health, you haven't listened to me, you're not brushing the way I recommend, you're not using my complete mouth care system, you're not doing adequate xylitol, then go have the cleaning, because you're not going to regrow your gums unless you do these things. But if you do all these things, you don't need the cleaning, you're controlling any oxalic or citric acids. Eat citrus fruits only as part of a meal. And things like kale and spinach, they're not good for snacking on because of the oxalic acid in these vegetables. So try to keep those vegetables that contain oxalic acid at meal times. Try and have them with some sort of fat, some kind of oil, some olive oil or some butter on them, because that will try to protect the oxalic acid from actually reaching against your biofilm and dissolving it away. That's actually what happens. So sipping drinks and even water is going to be quite damaging and make it more difficult for you to heal the gum recession. So try, when you've finished eating and drinking, have a little bit of xylitol, and then do not eat or drink for 30 to 60 minutes after your meal. And if you have a dry mouth or you have acid reflux, that would be the same thing. Try to keep your meals limited to these sessions of eating and drinking. End the meal with xylitol, and then do not eat or drink for 30 to 60 minutes afterwards, because this will give the good bacteria in your mouth a chance to organize and form this protective biofilm that is necessary if we are going to regrow the gum tissue back up the tooth again, which you can do providing you haven't lost too much of the tooth surface. That's the caveat to this. So it's still worth, even if you have lost, you have a channel like I do, I have kept my gum tissue at that same level. It's never got worse for 50 years. So you can do that too.
Thank you for choosing to spend this time with me today. My hope is that you feel empowered to take control of the health of your gums. You truly can prevent, reverse, and heal all kinds of gum problems in your own home. I have hundreds of videos on this channel for you to learn more about oral health, and I've just launched a new educational program on my website that I'm really excited about. You can find it at drellie.com. Thank you.